Story 31. I had a gastric bypass 8 years ago. After about 2 years, I started gaining weight and was constantly feeling unwell. Surgeon who did the bypass told me it was in my head and nothing wrong, even told my GP, etc. So I was blown off until I was admitted to hospital with severe anemia, gallbladder pain, and elevated liver sats. Turned out that he had messed the bypass surgery up in a spectacular way. I am currently waiting to have a hole in my diaphragm repaired, my pouch resectioned, as there is a hole between my pouch and old tummy. He made the pipe from my tummy to intestine too short by 2/3 s, and they think he has joined it to my bowel in error. The surgeon I have now is going to try and start fixing the mess, but has warned me I am in for multiple operations and a whole world of pain, and was horrified when I checked with him it wasn't all in my head. Sad thing is, the original surgeon is still allowed to operate on others. I am the third person I know of who he has messed up. Story 32. I'm a doctor up in Canada. Been in practice close to a decade. Seen all kinds of crazy things and have crazy things happen to my loved ones. Here goes. When I was still in training almost a decade ago, my mother had minor vague muscle and joint pain for months. We all thought it was muscle-related from all the housework/work that she did. She went and saw her family doctor, who ordered imaging. It basically came back all normal, i.e. nothing acutely wrong. The radiologist did make a comment about a sclerotic lesion on her hip that needs to be monitored. The differential was wide, but he did mention that it could be metastatic cancer. But the possibility was very small. He did ask for ongoing monitoring. My mother showed me the report. I even underlined the part about the possible metastatic cancer, and told her that she needs to follow up with her family doctor. She did see the family doctor within the week. The family doc said it was nothing and she's fine. Fast forward a few months, the pain never went away. She went to a walk-in clinic next with the same pain complaint. She was discharged home with some anti-inflammatory pain meds. Again, this was a mild vague pain, and her functional abilities were not affected at all at this point. This was a perfectly healthy woman in her 50s, never smoked a day in her life, did no drugs, ate well, exercised, and did yoga. She was never sick. She felt well enough to go on a months-long vacation overseas. While overseas, the pain became worse and worse. It got so bad she had to go to an overseas hospital. They completed CT and all kinds of imaging. It turned out to be stage 4 metastatic lung cancer. She never smoked a day in her life. After battling this cancer for 8 months, she passed. I went on the war path after this happened. It turned out the sclerotic lesion, picked up on the X-ray, was already an indication for metastatic cancer, source unknown at the time. The family doctor didn't bother looking any further. I unfortunately trusted her family doctor too much, as this was the only doctor of our lives. After this happened to my mother, I was ever vigilant of picking up things like this. Luckily for my career, as a result of my vigilance and the pain I went through, I ended up picking up all kinds of cancers simply by reviewing the radiology reports and doing exactly what the radiologist suggests. The radiologist often makes recommendations on repeat imaging after a certain amount of time. I'm surprised how many doctors simply don't follow up on that, as simply doing a repeat imaging in a set time can catch a lot of cancers. Another 2 examples I can recall. Also early in my career, in my first year of practice. This man came in for vague symptoms like fatigue, and just feeling something is not right. He wasn't able to pinpoint exactly what the problem was. He also never verbalized that he had any kind of neurological symptoms, or even a headache. I did all kinds of blood work, bodily imaging, but did not scan his head. Luckily for me, there was this much older doctor at the end of their career in the office, and simply wanted to see a few patients a day to pass the time. She ordered a head CT and found that this ma. I didn't follow the case after that, but I wouldn't be surprised if this man passed on fairly quickly. During COVID times, I was doing all kinds of telephone medicine gigs. This one case stands out and is very similar to the ones I experienced before. Patient calls me about diffuse bodily pain, literally everywhere. She had already gone to several walk-in clinics and was discharged home with pain meds, as the docs thought it was musculoskeletal. Well, knowing what I know and what I went through, I ordered a bunch of basic imaging, X-rays, ultrasounds, to actually look inside her body. Apparently, none of the other walk-in docs bothered to do this. Unluckily for her, it turned out to be some kind of metastatic late-stage cancer, source unknown. The cancer was everywhere, thereby causing the pain. She died a few weeks later. I've never even met her in person. All this was done over the phone. The family was grateful, and actually called the clinic to thank me personally for ordering these imaging when no one else had bothered to. The family said that she died fairly quickly after the imaging was done. They didn't even have time to find out the source of the cancer. Speaking of sclerotic lesions, I have a patient right now with this that I just picked up on imaging. I'm in the process of calling them in and do a full cancer workup. The uncanny thing is that the description of this lesion was exactly the same as the time it was used to describe my mother's lesion. I've developed a reputation as a cancer whisperer of sorts in my circle of doctors. The point is, don't be afraid to ask for basic imaging if you are experiencing unexplained pain lasting for a fairly long period of time. Cancers are much more common than you might think.